On MedThrive today. Timing births. Why is it important to understand and communicate it? Disclaimer: this video is made for educational purposes only. Some data and information might have changed due to medical advancement over the years. Well, let's get started. Becoming pregnant before the age of 18 or after the age of 35 increase the health risk of both mother and child. Every year, over 500,000 women die from problems linked to pregnancy and childbirth, leaving behind 1 million motherless children. Most of these deaths could be prevented by acting on today's knowledge about the importance of planning pregnancies. For health reasons alone, no girl should be pregnant before age of 18. A woman is not physically ready to begin childbearing until she is about 18 years of age. Babies born to women younger than 18 are more likely to be born too early and to weigh too little at birth. Such babies are much more likely to die in the first year of life. The risk to the mother's own health are also greater. All girls should be allowed time to become a woman before becoming mothers. In societies where many girls marry at an early age, couples should use family planning to delay the pregnancy until at least the age of 18. After the age of 35, the health risk of pregnancy and childbirth begin to increase again. If a woman is over the age of 35 and has had 4 or more previous pregnancies, then another pregnancy is a serious risk to her own health and that of her unborn child. The risk of death for young children is increased by about 50% if the space between births is less than 2 years. For the health of both mothers and children, parents should wait until their youngest child is at least 2 years old before having another baby. Children born too close together do not usually develop as well, physically or mentally, as children born at least 2 years apart. One of the greatest threats to the health and growth of a child under the age of 2 is the birth of a new baby. Breastfeeding stops too suddenly, and the mother has less time to prepare the special foods a young child needs. Also, she may not be able to give the older child the care and attention he or she needs, especially during illness. As a result, the child often fails to grow and develop properly. A mother's body needs 2 years to recover fully from pregnancy and childbirth. The risk to the mother's health is therefore greater if the next birth follows too closely upon the last. The mother needs to give herself time to get her strength and energy back before she becomes pregnant again. If a woman becomes pregnant before she is fully recovered from bearing a previous child, there is a higher chance that her new baby will be born too early and too light in weight. Low birth weight babies are less likely to grow well, more likely to fall ill, and 4 times more likely to die in the first year of life than babies of normal weight. Having more than 4 children increase the health risk of pregnancy and birth. After a woman has had 4 children, further pregnancies bring greater risk to the life and health of both mother and child. Especially if the previous birth have not been spaced more than 2 years apart, a woman's body can easily become exhausted by repeated pregnancy, childbirth, breastfeeding, and looking after small children. Further pregnancies usually mean that her own health begins to suffer. After 4 pregnancies, there is an increased risk of serious health problems such as anemia, thin blood, and hemorrhage, heavy loss of blood. The risk of giving birth to babies with disabilities or with low birth weight also increase after 4 pregnancies and after the mother reaches the age of 35. Family planning gives couples the choice of when to begin having children, how many to have, how far apart to have them, and when to stop. Most health services can provide several methods of safe, effective family planning. No one method of timing births is suitable for or acceptable to every individual. Couples should ask advice about the most suitable means of family planning from the nearest trained health worker or family planning clinic. Spacing birth at least 2 years apart and avoiding pregnancies before the age of 18 and after the age of 35 can help to ensure that each baby is born healthy and strong. This video is made in reference to data and information from World Health Organization, UNICEF, and UNESCO. Like and subscribe so you can be notified on part 2 of this series. See you on the next one.